If you've been told that you need surgery, injections, or that you'll just have to live with it, this video matters. I'm Dr. Bjarnason here at Thomasville Chiropractic and Emerywood Chiropractic. And what we've seen is that these options, as far as living with problems, as far as herniated degenerative discs, it's just not true. There's options out there. Most people are told your disc is worn out, it's just age, you need to strengthen your core. In reality, discs are hydraulic structures. Let me show you what I'm talking about. Discs have certain components. They have bones, which are called the vertebrae. Then they have the cushions, right? And then they have the nerves. Over time, if this hydraulic structure becomes problematic, it doesn't look as healthy as it used to. And those healthy components, the bones, the vertebrae, the cushions, they have a negative effect on the health of those nerves. And that's a big deal. Pain often comes from, as a hydraulic structure, from pressure plus dehydration, not just damage. Spinal decompression isn't traction. It's not inversion or stretching. It's controlled, computer-guided force, cyclical unloading, and creates a pressure gradient, a negative gradient, to pull things back towards the center, as seen in that poster up above me right there. We're not pulling the spine apart. We're changing the physics. Who is a good candidate? This is a question that I often get. For people, good candidates are people that deal with disc bulges and herniations, spinal degenerative disc disease, people that have been told they have sciatica, or even just chronic neck and back pain. You know, there's some cases that it's not ideal for. It's not ideal for people with severe osteoporosis, certain spinal inabilities, and advanced or fractures for that matter. That's just, we can't help everybody, but we can help so many, all right? Another thing that people talk about is it takes time, right? People want, and I've been there, I know that sometimes if I'm not feeling great, sometimes the first thought my brain has is, how do I make this go away, right? When in truth, it takes time, because for a long time, the blood supply, which is already limited to these cushions, it needs to be restored, right? We need to increase that positive fluid exchange. We're training the tissue. We're not forcing it. This isn't fast food healthcare. It's tissue adaptation. Patients go through phases: pressure relief, reduced leg and arm symptom pain. Then we go through fluctuations between getting better and then having setbacks. And then sometimes we're working against some of our own habits that we have, but eventually we want to get up that progress ladder up towards stability as tolerance improves. Decompression sometimes doesn't work for some people. They might get the wrong diagnosis. They might have inconsistent care, poor tissue support between visits, as far as the strengthening and the stretching exercises that needs to take place. And sometimes people don't move, and you got to move for things to improve. When we talk about decompression, we're not talking about just pain relief. We're not talking about magically going from here to here. We're talking about a functional approach to changing the physics, like we said, in the spine, to restore that spine on how it handles loads. If this sounds like you should get evaluated. Here at Thomasville Chiropractic and Emerywood Chiropractic, we do thorough evaluations to figure out if you're a candidate. If that sounds like you or somebody that you know that could benefit and is looking for an alternative to surgery, to constant pain pills and medication, we can help you. Reach out to us here at Thomasville Chiropractic. Give us a call at 336-472-7343, or look us up online at Your North Carolina Chiro, or like we said, thomasvillechiropractic.com. Have a great day, and we hope to help you soon.